Hi, my name is Stephanie, and I am an athletic training student at California Baptist University, and I am here to discuss management of diabetic emergencies and recommendations for athletic trainers. The NATA has put forth a position stand discussing recommendations for athletic trainers in regards to diabetic athletes. This statement can be found on nata.org. Management of blood glucose levels as close to normal as possible is essential to preventing a diabetic emergency, especially in athletes during competitions. This can be challenging because of the demands of physical activity on the body and their effects on diabetes. Organizations such as the American Diabetes Association and the American College of Sports Medicine have released statements regarding exercise guidelines for diabetics, but none of these papers discuss the roles and responsibilities of the athletic trainer in providing care for a diabetic athlete. The focus of this NATA position statement is to provide recommendations for athletic trainers who work with diabetic athletes. There are 6 recommendations, and I'll go through them one at a time and then recap at the end. The first recommendation is that diabetic athletes should have a diabetes care plan that includes information such as blood glucose monitoring, insulin guidelines, a list of other medications, recognition and treatment of hypo and hyperglycemic emergencies, and emergency contact information. Athletic trainers, school nurses, coaches, and other healthcare specialists should be involved with the care plan and be willing and able to assist at any time. Recommendation number 2 is that the athletic trainer should stock the athletic training kit with supplies to treat a diabetic emergency. These supplies include a copy of the care plan, equipment to monitor blood glucose levels, sugary foods or fluids in the event of a hypoglycemic episode, urine testing supplies, a sharps bin for used needles, and spare batteries for all glucose meters. The third recommendation is that prior to the athlete's participation in competition, a physical examination should be completed by the team physician or primary care physician. It is recommended that athletic trainers be familiar with diabetes-related illnesses and how to recognize and treat them. The physician will ultimately clear the athlete for play prior to participation in sport. The fourth recommendation is that athletic trainers should know symptoms and treatment of hypo and hyperglycemia. Hypoglycemia typically presents with tachycardia, sweating, palpitations, headaches, dizziness, etc., and can progress to blurred vision, fatigue, difficulty thinking, and loss of consciousness. This can be fatal if it is left untreated. Symptoms of hypoglycemia are often specific to the individual, so athletic trainers should know their athletes. Treatment of hypoglycemia involves a glucagon injection for which athletic trainers should be prepared. Hyperglycemia presents as nausea, dehydration, sluggishness, and fatigue. Athletic trainers and their athletes should work with the physician to determine the appropriate balance of insulin during a competition. Athletes should be encouraged to drink non-carbohydrate drinks if in a hyperglycemic state. The fifth recommendation is that athletic trainers should be taught proper insulin injection techniques. Always insert insulin into the subcutaneous tissue. Typical injections sites include the abdomen, upper arm, and upper thigh. After insulin injection, athletes should avoid extreme heat or cold temperatures, as these can affect insulin absorption rates. The sixth and final recommendation is that the athletic trainer should know TSA guidelines for traveling with diabetic equipment if the athlete is on a traveling team. The athletic trainer should be prepared for the duration of the trip, including prescription medication, extra medication in case of a lost luggage, a physician's letter authorizing the medication, and prepackaged snacks. According to the NATA, athletic trainers should work with a team of medical professionals to ensure the health of the athlete and maintain proper glucose levels throughout competition. The 6 recommendations, again, are a diabetes care plan, a stocked athletic training kit, pre-participation physical exam, symptoms and treatment of hypo and hyperglycemia, proper insulin injection techniques, and appropriate travel guidelines.